Hi, everyone. We're going to get started in just one moment. We're just waiting for everyone to come in from the waiting room. Great. It looks, okay, we still have a few more people trickling in, just as I saw pause. Hey, looks like most people that are going to be joining are here. So Allison, I'll pass it off to you if you want to get us started.
Thank you all for logging on today and spending your lunch with us. We are excited to be meeting with you. And for our webinar today, we can start sharing our slides. We'll be discussing DBT caregiving strategies for teens with emotional challenges. Um, Anya and I co-lead a parenting class on this topic with the same name. And so today we'll be reviewing the topics and skills and strategies that we teach through that class. And then we've selected one of our favorite skills to go a little bit more in depth with. I, for some reason, can't see the slides, but I'm wondering if, there we go. Okay.
I was like, there's
Wonderful. So my name is Allison Vreeland, and I am a clinical psychologist in the child and adolescent psychiatry clinics. My pronouns are she, her, and I am a member of the Stanford Parenting Center, SPC, which focuses on empowering parents to tap into their existing parenting abilities and to learn evidence-based strategies to help recognize and even diffuse and treat their child's mental health difficulties. I am also a clinician and researcher in Stanford's Immune Behavioral Health Clinic, which works with children and adolescents with existing neuropsychiatric disorders.
Hi, everyone. I'm Anya Atasuntseva. You also use she, her pronouns. I'm a clinical psychologist here at Stanford. I'm predominantly in our adolescent DBT or dialectical behavior therapy program here at Stanford, as well as in the joint Stanford and Children's Health Council RISE DBT intensive outpatient program. DBT is a treatment that predominantly focuses on treating adolescents with suicidality and self-harm. And in addition to seeing individual patients that struggle with suicidality and self-harm, I do a lot of parenting work within our DBT clinic and supporting parents who have children that have really strong, oftentimes volatile emotions that are challenging. And so this kind of class and really this focus on using DBT skills for all kids was born out of the idea that when your youth has really strong emotions, it can be really difficult and challenging as a parent to know how to respond effectively and can be very stressful, and that there's just not enough for support for parents out there. So we've sort of brought it out of the land of suicidality and self-harm alone and adapted it into a platform that can be useful for all parents. Yeah, so lovely to meet all of you.
Um, we are giving this presentation through the Stanford Parenting Center, which ensures and partners with parents in supporting their children's mental health and well-being. So we provide a wide range of programs and complementary resources to parents in order for them to gain confidence in their skills and find greater enjoyment in their parenting roles, decrease the risk for pediatric psychiatric disorders. These resources are provided through a library of free webinars like today's. This recording will be sent out to everyone who registered for the talk, but they can also be found on our YouTube channel. We also provide virtual parenting classes and support. like the class that Anya and I co-lead on this topic. We provide parent-focused treatment, including individual support and individual therapy and mindful parenting groups. So on our next slide, here is a list of all of the different parenting classes that we are offering through our parenting center. We target supportive parenting for anxious childhood emotions, how to be mindful as we're parenting, how to manage challenging behaviors and support little ones with big feelings, as well as our topic today, DBT caregiving strategies. If you can scan our QR code or find more webinar series through our YouTube, and you can also follow us on social media. We have a Facebook page, an Instagram page, and a YouTube channel that you can follow. And you can identify all of those places to follow us through that linked tree link right there.
We just want to announce that, as we mentioned, today's webinar is sort of an overview of the longer 6-week psychoeducational parent course that we have for families. Our next round of the DBT caregiving strategies for teens with emotional challenges class is going to start January 22nd, and it's going to run through February 26th. It is on Wednesdays at 1 p.m. via Zoom. So if you like what you hear today, or we're really touching on a few of the topics that we expand on in more depth over the 6-week course. So if you're interested in any of these topics, we highly recommend that you consider visiting the Parenting Center website that's on the bottom here and considering signing up for the course. We'll have another one. If you're not able to attend the one in January, we'll have another one in the spring as well. Yeah. We have a question in the chat that I'm just going to address very quickly that says, do you have suggestions about getting kids into care, outpatient therapy classes, et cetera, when they're opposed to going either virtually or in person? So today we're going to be briefly reviewing some strategies for increasing behavior of our youth in general, whether it's increasing the likelihood that they're going to go to therapy or any other behavior you want to see. So stay tuned for that in a few moments. You can consider taking the course to learn more, but hopefully we'll answer that question as we talk about how do we get our kids to do anything we want them to do in a little while.
So as Anya spoke to, DBT is a behavioral treatment for adults and children with significant difficulty regulating their emotions. And so we start our group and our class really discussing the biosocial theory, which is a theory that helps us better understand how adolescents develop difficulty with emotion regulation and how these problems and these challenges are maintained. So the biological piece really refers to our biological makeup, and in particular, really just the wiring in our brain that contributes to how we might experience and control emotions, how we might act on urges, how we might navigate really challenging emotional situations. Increasing amount of research that we look into suggests that powerfully emotional people are just wired differently. And this is just luck of the draw. We don't get to choose. Some of us are just more sensitive than others. Sometimes we call these children super sensors. They just really feel things intensely. And this can be beneficial in a lot of different ways. It can help us be really passionate about our interests, help us be creative and motivated to do things that are important. However, we also know that these strong, powerful emotions can become problematic when we have difficulty regulating them. So when there is an individual or a child who has this biological vulnerability to emotions and they can't effectively regulate them, they are vulnerable from the biological perspective. So that's the bio piece. Pairing that with an invalidating social environment is when more problems seem to arise. So we will discuss validation in detail later in this talk. But but what we know about validation is that it is a way to confirm or to corroborate, verify, and communicate an understanding of. And conversely, an invalidating environment communicates that what you are feeling, thinking, or doing doesn't make sense and is considered inaccurate or an overreaction. Um, everybody can make invalidating statements from time to time, from teachers to parents to peers, therapists, and oftentimes we might, be really well-intentioned when we're making that invalidating comment. We might say like, "You're fine, you're okay, you're overreacting." Um, but over time, I might think in that environment of invalidation that, oh, wait, I'm sad, but people are telling me that I'm not sad or that I shouldn't be sad. And so we might ignore that emotion until it's so big that it's impossible to control. And so validation, as we'll discuss later, is a tool to really counteract this. We also discuss mindfulness on the next slide, um, including the benefits of increasing non-judgmental awareness and attention to children's thoughts, feelings, and behaviors. So mindfulness is just being aware in the present moment, without judgment, without trying to change it. And it includes attentional control too. So staying focused on one thing at a time. Um, we also teach skills for identifying our three states of mind. So reasonable mind, emotional mind, and wise mind. We focus on wise mind, which is really the synthesis of those two. It's the state where we make optimal decisions. And so we introduce ways to observe, ways to describe, ways to participate in activities, as well as how to do this, how to not judge, how to stay focused, how to do what works, both in a way that can really elevate our parenting and help us remain focused, as well as learning strategies on how to help and support this in our children.
Yeah, as Allison mentioned, the kind of the goal of mindfulness is really twofold. On one hand, by developing these skills to be non-judgmental, to be aware of sort of um, what's going on with your children, what's going on in your environment, and to be focused is really powerful because it allows us to sort of like stay out of our big emotions as caregivers, that may lead us to making like ineffective decisions you know, or extreme feeling really extreme emotions ourselves that lead us to ineffective parenting. So in one role, it kind of helps us connect with our kids better. The other really goal of mindfulness for parenting is that parenting, especially parenting emotionally dysregulated kids, is really, really stressful. And so mindfulness can really be a quick self-care tool that parents have. So if you come to our 6-week course, one thing we'll be really talking about many different ways to practice mindfulness. I think mindfulness is a really big buzz term nowadays for parent of how it can be really helpful and effective, and it certainly is. And personally, I find some of the ways that it is, talked about in main, bigger media is really unattainable for a lot of parents. I'm sure many of you do not have 40 minutes to do a guided meditation, let alone 5 minutes. So we really like to focus on like what are short bursts, 30 seconds, 1 minute that you can learn to practice mindfulness so that to take a more non-judgmental stance to your child so you can build a much more productive, positive relationship with them, that you can reduce your own suffering, your own stress in those moments. So really our focus in mindfulness, especially in the course, is to teach a kind of mindfulness that feels oftentimes much more attainable to parents. So in weeks 3 and 4, we focus on sort of the skills that are often core to DBT or dialectical behavior therapy. The first of which is dialectics. So simply put, dialectics is this idea that two things that seem opposite at the same that seem opposite can be true at the same time, and really focusing on how taking a dialectical stance, particularly as caregivers, can let us maybe let go of some of the frustration, stress, anger we might feel towards our kids and really understand where they're coming from. So the biggest sort of dialectic or this balance of two things that seem opposite that we have in DBT and that we really focused on teaching in this course is this idea that your child and you as a parent are doing the best you can, that in any one given moment, even when your child is really not listening to you, not getting out of bed, not doing these things. How can you look at that behavior as that for them, it's not the best they can ever do, it's not the best they have done in the past, but that in that moment, given the resources they have, the skills they have, whatever is going on for them internally, that that might be the best they can do. And really having this view that your child is doing the best they can let go a lot of the anger, frustration, that may come along, understandably, with them not being able to complete things that are really needed or that we find that are effective, and coupling that idea of some of acceptance that they're doing the best they can with this other idea of change, and that both of those things can be true at the same time. So my child is doing the best they can. I'm doing the best I can as a parent, even when I'm really struggling, can't maybe pay as much attention to my kids as I want to, or whatever they are, with this idea of change that your child needs to do better, try harder, and be more motivated to change in the future, as do you as a parent. And how do we hold both of these truths at once? I like a few of the other dialectics on this slide. I can do this and it's going to be really hard. My mom is really strict and she cares about me. So we bring this idea of dialectics into this idea of dialectical dilemmas and really talk about how in parenting there are sort of a few really common dialectical dilemmas that come up, or opposites that really need to be balanced. Some of them being, how do I provide parenting that is not too loose, where I'm being overly permissive and letting my child do whatever they want, nor providing parenting that is too strict, where it is very, very punitive and consequence heavy, and my kids feel like they um, can't have a conversation with me, or can't, sort of ask for something that they want or need. How do we find that balance? And then another dialectical dilemma we really approach and talk about is this idea of like making light of problem behaviors. So taking your child's behaviors that might be concerning as not serious at all, like not seriously, or not taking certain behaviors as seriously, versus making too much of typical adolescent behavior. So, all teenagers tend to have a little bit of an attitude or struggle with the parent-teen relationship. And when do you know when those behaviors go away from the typical sort of things we will see in adolescence, moodiness, messy room, and into the area that they might be actually not no longer a typical adolescent behavior, but something that you really need support and help with from a mental health provider or another provider. And then finally, the dialectical dilemma we really talk about and like to focus on is this idea about like, how do we support our kids in gaining independence slowly over time, step by step, without forcing too much independence that they might not be ready for, and that they feel like not of an accomplishment with not fostering dependence, or not sort of jumping in and solving all of our child's problems for them before they have a chance to solve their own, so that they don't gain that independence. So I encourage you all, and one thing we do in our class is really think about like, where as caregivers do we fall on these lines? Where do our kids think we fall on these lines? Where do our co-parents fall on these lines? And really thinking of the idea that actually the goal here is to not be perfectly in the middle of any of one of these dialectical dilemmas, but to avoid jumping between extremes. So really the goal here is not that you always have to be very strict or always have to be very loose, or that it's never okay to be very strict or to be very loose. In fact, especially in my population, when we're talking about issues of safety, it is really important to be strict or provide a lot of monitoring at times. However, as parents, what's helpful or effective to avoid is to really jump between extremes of like, one day we're saying, no, you can never have your phone back because you haven't been giving it up at the time that we've agreed upon, to I'm just not going to pay attention to your social media use whatsoever, and you can kind of stay on your phone all day. So really the goal is to learn to kind of hold that you can both be loose in some areas and strict in other areas, and be flexible and responsive as a parent, and just to avoid jumping between one extreme or another, as that sort of inconsistency can really be confusing um, to our adolescents.
And
Um,
dialectics thinking, saying that both of these things can be true, right? I'm doing the best I can and I can do better and try harder. And that dialectic, that kind of opposing viewpoints is really present as well with parents and kids. We might think that we're kind of on the opposite ends of a situation where I really need you to come home in time for curfew and your child really wants to stay out. And so really trying uh, to work to identify strategies to help us get unstuck from viewing a situation only one way. Because viewing a situation only one way can often lead to a lot of family conflict. And so these dialectics, both within ourselves, but also across parents and kids, and how do we compromise and honor, both of these perspectives that, may seem like polar opposites, but we can, really think about the ways to honor and validate and collaborate to compromise on those two things that seemingly are opposites.
Yes, exactly. Thank you, Allison. We often kind of call this kind of compromise in dialectics a middle path because really learning to compromise, not in that kind of no one gets what they want in the compromise, but really, and we'll see this as we learn validation in a few minutes, but learning to really how can both meet the needs of the teen and the needs of the parent be met? How can we find these dialectical compromises or middle path that meet the emotional needs of a parent as well as the emotional needs of a teen? So, one example we often give or talk about is this idea of like your teen wants to stay out really, really late for a concert, but but you have a very specific curfew for them. A compromise would be just that, they come home maybe an hour earlier than they wanted, an hour later than you wanted, but that would actually meet no one's emotional needs because the teen wouldn't get to see the band they really wanted to see, and the parent wouldn't necessarily feel like the kid is safe staying out late. So how do we find sort of compromises or middle paths that meet the emotional needs of everyone involved in this situation? So some examples of possible middle paths, although it's not the only example or the only possible solution there, would be like to have a trusted adult go with the child to the concert. So really starting to think about, in parenting, when we have to make these compromises, how do we do so in a way, both considering what's really important to us as well as what's really important to our children. In the fourth week, we talk about validation. I'm not going to go into this too much right now because at the end, after we kind of go over our seminar, I'm going to spend a lot of time teaching you validation. So I will just move on for now and we'll get back to our little mini lesson momentarily.
We also discuss kind of one of our biggest challenges as parents, which is how do we get teens to comply with our requests and comply with our rules? And so we review really effective ways to change behavior, both strategies to increase desirable behavior or behaviors that we want to see more of, and strategies to reduce behaviors that we don't want to see as much. At the focus of these skills is really initially just how to identify and target a behavior. So making sure that when we're identifying a behavior we want to see more of, we're being really specific and identifying something that's measurable. I'm not saying like, I want you to be good or I want you to be happy, but what does that mean? Do I want you to follow through with an instruction when I give it to you the first time? Do I want you to engage in more activities that, lead to an increase in mood? But really being specific about what is the behavior that we're attempting to alter, increase, and or decrease. And then with those behavior change skills, we review different strategies on how to use reinforcers. And so when we think about reinforcers, those are really just consequences, which is something that comes after a behavior. So anything that comes after a behavior is a consequence. And we can use a reinforcer to increase a behavior, which makes it more likely that that behavior is going to increase. So reinforcers provide information to our children about what we want them to do more of. This can include either adding a positive consequence or a reward, If you're familiar with behavioral star charts, that is kind of a very clear example of how we use positive consequences. If you do this thing, you might get a positive sticker, you might earn an opportunity to get a reward. Positive parenting strategies are often, more effective than relying on negative feedback or punishments for what teens are doing wrong. And so we really focus initially on those positive parenting strategies. We want to provide positive rewards and reinforcement about 5 times as much as we're using punishments. Our most effective and free currency we have as parents as a way to modify our child's behavior is attention. And so a positive consequence of engaging in a behavior we want to see more of is just praise. So specific labeled praise of catching our kid, doing right. But we can also remove an aversive consequence. So this could look like, having a kid get out of a chore that they really don't like if they're engaging in a behavior we want to see more of. An example kind of maybe in our day-to-day life of a positive aversive removing an aversive consequence is if I have a headache, I might take an Advil, and that removes kind of this aversion of pain, which makes it more likely that the next time that I have a headache, I'm going to take an Advil. We can also weaken behavior in our children by removing the reinforcer, so no longer using a previous reinforcer, or by providing relief before an unwanted behavior.
So thinking about the beginning of behavior, like oftentimes kids are doing behaviors because they're getting something out of them. Something about that behavior is working for them. So when we're putting on a behavior, like when we're trying to extinguish it or put on extinction or weaken it, oftentimes thinking to ourselves, like, what is the thing that my kid is getting out of this behavior? So, oftentimes that can be something like attention. Like, if you're children are constantly getting in fights with one another or really annoying their older sibling because they really, because the sibling reacts very strongly and gets a rise out of them. One way to weaken that behavior is to have the older sibling stop responding to them if possible so that they can, getting that attention elsewhere or redirecting them to a different task. So really thinking about like what might be, even if the behavior is really intense, what is my kid maybe getting out of this that it is very reinforcing for them, and how can I remove that reinforcer? Sorry, Allison, back to you.
That's perfect. Yeah. And so when we think about reducing a behavior or suppressing a behavior, really thinking about, what is the function of that behavior and how are we responding to it? So we often might actually be paying attention to our children more when they are doing things that we don't like. If our kids are fighting with one another, we might put our phone down, put our newspaper down and intervene. But if they're getting along with one another, we might be distracted in our own emails or in our own devices. And so really trying to think about how we're monitoring and how we're using our attention and our consequences, our responses after the behavior that we see as a way to modify and either increase or decrease the behaviors we want to see in our kids. So if we're trying to decrease a behavior, we can add an aversive consequence or a punishment. This might look like a timeout. Really thinking about choosing a punishment that leads to a reduction in the behavior. We can also remove a positive consequence. Or remove something that's desirable. So loss of a screen time. When we think about punishments, we really first and foremost want to make sure that we're communicating our rules and expectations to our kids in advance, so that they have a clear understanding, as Anya was speaking earlier, kind of about being too strict and too lenient, and that when we think about where we want to be on that dialectic, it's not necessarily right in the middle. It's just working to not be jumping from too strict to too lenient, And a lot of that is so that our children, know what is predictable, that it is expected, that they know what is coming up. And so same things with kind of these reinforcements and rewards and consequences, that it is something that is kind of clearly mapped out. It is predictable. It is expected, and they know that if I engage in this behavior, I either earn this reward, or if I do this undesirable behavior, this is the consequence that's coming. Um, not all consequences are created equal. So when we think about what type of consequence that we're providing, and again, a consequence just is the response to after a behavior. So a consequence includes rewards and it includes punishments. We want to think about the context. A reinforcer in one situation might be a punishment in another. If I am trying to motivate myself to exercise and I say that I get a coffee, if I go on a run. Well, if I go on the run in the morning, maybe that is a really wonderful reinforcer. But if I'm running in the evening, maybe a caffeinated drink is not as motivating to me in that afternoon. So really thinking about the context in these situations, as well as the quantity. Um, if a reinforcer is too little, that it doesn't seem to be moving the needle, that might not work. Also, if we have an overabundance of a reinforcer, gaining more of it, or engaging in a behavior to get more of a reinforcer that I already feel like, whoa, I don't even have enough time in my day to use all of this screen time. I'm sure that we would love our children to say that. Quantity counts as well. Um, Natural consequences work best. And so we often, we discuss a lot about natural consequences and letting them do the work if possible. Um, if, our children stay up really late and they don't perform well on a test, that bad grade is a consequence of that behavior. And really thinking and monitoring and paying attention to how the behavior changes in response to the consequence, because that is the information and the communication to let us know if we've identified the appropriate consequence for our goals. If we're providing a punishment, go to your room, and it's not actually leading to a reduction in behavior, that isn't by definition a punishment, because it's not reducing the behavior. They might go to their bedroom and have lots of games that they enjoy, and they read their books. And so actually that isn't leading to a decrease in the behavior. And we really want to be mindful of how behaviors are changing as we're using these skills and applying consequences.
We have
Uh,
a chat, Allison, and I know we're going to take questions later, but I just think it's related to this. I learned that positive reinforcement is the most effective way to see behavior change as opposed to punishment slash consequence or negative reinforcement. Would you agree to this? So I'm curious. I have my own thoughts, but I'm curious to hear your thoughts.
Yeah, we definitely know that positive reinforcement is one of the most effective ways to see behavioral change, and it leads to behavioral change, whereas punishment really can lead to just kind of a reduction or a pause in behavior, but not necessarily a change overall. So the best kind of analogy that I think actually I learned from you, Anya, that I think exemplifies this really nicely is if we're driving on a highway. And we know that there is a police car that and a speeding trap on one section of the highway, we might reduce our behavior for that period of time. But as soon as we're gone and that police car is away and we know we're out of that speeding trap, we might go right back up to our over the speed limit speed and driving really fast. And so that punishment of getting a ticket is actually not changing how I'm driving globally. It's changing how I am in that moment while I'm trying to avoid the punishment. But if I want to really see behavioral change, positive reinforcement is the most effective. But Anya, I would love your 2 cents as well.
Yeah, I would agree. And I just want to clarify for people that might be confusing these two things. Negative reinforcement is not a punishment. Negative reinforcement is a type of reward. It just means we're taking away something, we're subtracting something the kid doesn't like as a reward for doing a behavior we want to see. So I think that positive reinforcement is a bit more effective sometimes because it's easier to just give a reward like praise immediately after a behavior happens. So your child takes out the trash immediately, you give them a star on their star chart or say, I really appreciate that you took out the trash, or give them whatever the desired reward was. I think for some children, negative reinforcement can be really, really effective. It's just sometimes harder to do in the moment. And with reinforcement, making sure to give the reinforcer as soon as the behavior happens is really what's most effective. So, saying like, okay, you took out the trash today, so you don't have to do the dishes tomorrow. Although that's negative reinforcement and is increasing their behavior to take out the trash in the future. Because it's sometimes negative reinforcement is delayed a little bit, it can sort of not be as powerful. However, it's a really effective tool for a lot of kids. And one thing we'll talk about if you join our class is really looking at like how sometimes negative reinforcement or the relief that we feel really keeps behaviors going. So that, for example, we see this with avoidance of homework or school a lot. Like kids are, avoidance is usually negative reinforcement. They feel that relief of not having to do that work immediately, and then it keeps the behavior of not doing their work going, even though obviously down the line they're going to feel stress. So the question earlier, how do I get my kid to go to therapy? I would consider ways you might be able to increase, to utilize some positive or negative reinforcement, some kind of reinforcer or reward around therapy. So it might be, we've had a lot of families have success with building sort of smaller reinforcers throughout. So like immediately after you go to session, we are going to, we are gonna go get your favorite boba immediately after therapy. And after 5 sessions of therapy, you get to do this bigger thing, would be an example of using positive reinforcement. Or you get out of this other activity that you really don't like doing. Like you can drop this sport that you've hated for a long time or something like that. So thinking about ways for your own family that you can really reinforce them going to treatment might be one way to get them in. Other questions I'm going to hold until we finish because I want to make sure we have time for our little teaching of validation, but I hope that's helpful to start thinking about. Anything else you wanted to say on reinforcement, Allison?
I think that just globally, when we think about reinforcement and rewards, we're really breaking these skills down into how to increase behaviors we want to see more of and decrease behaviors we want to see less of. So any behavior we want to increase, whether it's increase engagement in therapy or attending school, all of these behaviors and these strategies can be used in that same way in terms of getting boba, getting a star, earning kind of whatever it is that, I always tell parents to find your kid's currency. And so just broadly, thinking about using these strategies in that way.
Yeah. And yes, exactly. And I think a lot of the work that when people go to individual parent coaches is this is a very high level approach. So, in my individual parent work with kids that are involved in our DBT program, it's a lot of very specifically how to apply these skills and problem solve when things are going wrong. And we're sort of giving you a higher level picture of this. Okay. All right, moving on. We wanted to leave you with a skill you can hopefully leave today and start using with everyone in your life, but particularly your children immediately. So, as you heard Allison describe earlier in the session, this idea that some of us are born more biologically sensitive or vulnerable to emotions. And so, validation is a skill that works for everyone. And especially if you have a kid that's a super sensitive, that's really sensitive to strong emotions, this might be a skill that's particularly useful to you. So, at its core, the idea of validation is that you are communicating to another person that their emotions, thoughts, and reactions make sense. So, all emotions are evolutionarily important. Humans developed them for a really long time because they communicate something really, really important to ourselves. They communicate important things to other people. And so this is important as we think about validation, because if we feel as a human being that our message, the emotion we're sending out, the message that we're sending out to the world is not being received, not being understood, or not being, or that emotional need is not being met, we naturally, not on a conscious level, but unconsciously in the back of our mind, are going to elevate our message. We are going to escalate it. We're going to like express it stronger and louder so that that message can be received. The cool thing about validation is that it's pretty much the only way any of us have to change another person's emotions. So, unfortunately, none of us have the magical power. While we can influence people, we cannot change anyone else's emotion. However, validation is the one skill that does that. Because what validation does is it communicates, hey, your message has been received. I understand where you're coming from. And once that person feels like, okay, my message has been received, then their emotion will naturally come down because they realize I don't have to communicate this message stronger and stronger over time. So you'll hear us say this a lot, but validation does not mean agreement. It does not mean rewarding your kid for their behaviors that you don't agree with. It doesn't mean you have to agree with their emotions or agree with their behaviors. It's simply communicating that the emotions behind their behavior, whatever their emotional place, that makes sense, that you are doing your best to understand that where they are coming from. So, a common example I'll use from this is if I am doing something at work that my boss does not like, let's say like I'm really behind on my notes or something, and my boss comes in and she would never do this, but she screams at me and is like, Anya, how dare you? You didn't get your work done. This is totally awful. Then I could respond with validation by saying something like, it makes sense that you're really frustrated that the work I agreed to complete isn't finished yet. So that is not saying that her behavior of yelling at me is okay or appropriate or allowed. It is not agreeing with the behavior. It is trying to get at the emotion behind the behavior, in this case, anger or frustration, and communicate that, like, I understand why, from her perspective, she would be frustrated or angry because if I don't get my work done, it causes more work from her. And by really communicating this understanding that her emotions make sense, that might de-escalate it. Have her see like, hey, my message has been received. This person really understands where I'm coming from. De-escalate her enough. Bring down that high emotional temperature enough that, and then afterwards, we can really go into what might be useful feedback around how I like to be spoken to. But when people are in a really dysregulated state, when they're in a high emotional place, they cannot hear the problem solving or the teaching that we want to do or the point that we want to make. So by validating first, it's really powerful because it improves our relationships. It helps our relationships with everyone in our lives. It helps us kind of get unstuck from maybe our own strong emotions. It helps that person feel like, hey, like we're really listen. That person's really listening. They really care about what we are, what I am saying, and that can de-escalate them enough that then they can hear maybe the behavior change part. And so while validation does not really necessarily mean agreeing with what the person is saying, we are trying to really understand like where is their emotion coming from? Where does that tiny kernel of truth in what they are saying that I can validate? So we can use this with other people and we can also use this with ourselves. So if we're feeling really, really sad, doing some validation of our own emotions, like it makes sense that I would feel sad if I keep trying to reach out to my kid to spend time with me and that they don't want to spend time with me. That can be a way we can regulate our own emotions. When we turn to invalidation or communicating that another person's thoughts, feelings, behaviors do not make sense or manipulative, strong, wrong, it can lead to these explosive actions like Allison was talking about earlier because the person feels like, okay, I have to communicate this even stronger. So there are many ways that we can validate, and during our week 4 of our class, we go into a lot of the different ways we can validate. And before we start to address many of the questions in your comment and take more questions, I really want to focus on one way that we validate, and I'm going to put it in the chat because it's a little script we like to use, which is it makes sense that fill in the emotional blank, or it is understandable sorry, I'm having a hard time talking and typo, that fill in the emotional blank. So it makes sense that you're really frustrated with your math teacher because you got a bad grade on your test when you feel like you studied. even if you as a parent know, actually they didn't study. You really want to get to that emotional point before you can then problem solve of how they can do better. It's understandable that you're really sad because you feel like you waved at your friend and you didn't see them wave back. One thing I will often hear from parents is that this feels really robotic at first, sometimes. So I really encourage you to practice in this format first, because often what happens when we're first learning to validate is that we may start out with a validation, but then we say, but you should have studied more for the math test. And nothing is heard after you put that but in there. They don't hear anything else you say after. It comes off as an invalidation. So we really like to practice in the short format of it makes sense that, it's understandable that, when we're first starting out practicing our validation, so we don't accidentally invalidate instead. There are many other ways to validate as well, which I'll just briefly mention. One is by paying attention, which oftentimes I talk about as being the hardest way to validate because we are so busy, especially as caregivers, so distracted. It is really hard oftentimes to not be putting away the dishes as I do when your family member is trying to talk to you, or on your phone, or whatever else it is going on. So really just looking, listening, observing, making eye contact, staying very focused on someone is a very powerful way to show that you care about their emotions and really are trying to communicate that their thoughts, feelings, behaviors make sense in the moment. Again, doesn't mean that we're saying those behaviors are effective, simply that they, given where the person is at in their life in that exact moment, make sense. That is our brief skills teaching on validation. I could go on to this for a long time, but I know we have a lot of questions already in the chat and more coming, and I'm sure there will be more. Well, I should say, Allison, do you want to add anything on validation before we move into some of the questions in the chat?
No, I think you did a wonderful job. Yeah, I think transitioning to some of these questions would be helpful. I think kind of on the line of validation, we have a question about psychologists who are arguing against the behavioral approaches and for collaboration and co-regulation. Pairing this validation with the behavioral skills that we discussed in terms of increasing and decreasing behaviors is really in line with a lot of the strategies that have been discussed otherwise, right? We want to validate the emotion. If we think about what these behaviors are communicating, they're communicating, they're a way for our children to be communicating. So we can, validate, I know that when you're yelling, it seems like you're really mad. And we can have them change their behavior, right? So there's that dialectic there as well. But really using that validation kind of with these behavioral approaches kind of helps with collaborating and co-regulating.
Yeah, so someone said in the chat that that question was specifically, I just took off, so we're not they can see us more. That question was really about reinforcement. So I think like, yes, behaviorism is reinforcement, correct? And I think the idea that behaviorism is not effective, I would not agree with that sentiment. I think behaviorism, like specifically reinforcement or punishing or extinguishing rewards, is happening in the background for all of us every single day. And it is really about recognizing how those reinforcements or consequences, any of the behaviorism is occurring to us naturally. Like we go to work, we get paid for our jobs, we're more willing to go to work. That is behaviorism. Whether or not you are taking a behavioral approach with your children or not, they are being shaped into things and certain behaviors in their environment constantly. Now, the question is that like a DBT approach balances change or change on its own, aka behaviorism on its own, with more acceptance-based practices, which can include things like co-regulation. So validation is a form of helping your child regulate themselves or co-regulating with your child if you're doing co-regulation. Using mindfulness with your child is a form of co-regulation. So I guess we're not arguing not to do co-regulation. We're recognizing that behaviorism is playing out naturally for everyone and really is the way all of us as humans learn behaviors, and that it is not about using one skill or behaviorism alone, but really by combining both acceptance-based strategies that allow for co-regulation or allow us to really understand where our child is coming with with in collaboration with our children behaviorism strategies. So neither Alice and I are at all are arguing you go, punish or reinforce your kids without their knowledge. It's actually way more effective if they are partners in this. So you are having discussions with them about what is reinforcing, what is regulating that, what is reinforcing to them, and coming up with these reinforcers together, and that they have a really clear understanding of contingencies. So, like, if you do your homework, then and this is going to be an example everyone hates, but I'm just going to do it for the sake of this example, then you get 10 more minutes of video game time or whatever it is. And if you don't do your homework, then then you have to stay home after school an hour later. Um, to work on the homework that you have missed. And there was a question earlier in the chat that now I can't find, which was that oh, here it is. I'm struggling to find things I could use as rewards for my daughter. And I'm just going to piggy bank into that question because I think it's related. So she would rather not do it or not gather rewards. So this is something we commonly hear. So usually it's whatever we're choosing is not rewarding enough for the kids. So I would really brainstorm. I think these are the type of teenagers that I find negative reinforcement to be the most effective with, because a lot of kids that don't respond to common rewards do respond to the ability to avoid things they do not want to do or do not like as much. So I encourage you to maybe try some negative reinforcement. And I'm curious, Allison, if you have suggestions for parents that are finding that the rewards they're offering are not effective or their kids do not respond to rewards.
It really is about finding your kids' currency. And at the very least, I tell parents that something that previously your kids were getting without having to earn it can be changed and modified to be used as something that they are earning now. So if, our children aren't really motivated by anything and they have access to their phone, it is perfectly appropriate to say, okay, now you need to earn that access to your phone by completing this list of chores, or by these are kind of our house rules. But it can be a really collaborative conversation, trying to empower and bring children and teens into this conversation of saying, like, this is an opportunity for you to earn something. It could be that maybe small day-to-day things is not something really that they're motivated by, but maybe a big reward is something that they are. And so the small ones can be, individual stars, and you come up with a price point or how many stars it takes to earn, this movie outing with our teen. But really just trying to find, like, what is your kid's currency, and at the very least, positive attention and positive praise works for everybody. So we can certainly utilize that. I saw a question about what to do, or how to respond when we might use the script that we provided. Like, it makes sense that but maybe our teen or the other person is blaming us for something. How do we say, like, it makes sense, but don't include the but? And that really, has to do with honoring the other person's perspective. And that doesn't mean that we're necessarily agreeing with them, right? Validation doesn't necessarily mean agreement. It just means that we understand their perspective. So it makes sense that if you thought, fill in the blank, you would feel really mad. It would make sense to me that if you thought that I changed the rules on you, that I caused this, it makes sense that if you're blaming me for this, you would feel really mad. I get that. It doesn't mean that I agree that I'm accepting the blame in this situation, but just that I really can understand their perspective. If I thought that way, or if I saw it in this way, or if I were blaming me for this situation, I would feel really frustrated too.
Yeah, and I think that really like continuing on this with the idea, I always tell parents it takes a lot of like skills on your end, because I would say like it's validation pause. Like you really have to include the pause there before you move on to the all other things. And just I think what's helpful for me is reminding myself that validating first and then waiting is really going to be in my best interest, because my whoever I'm talking to in my life, they're going to be able to hear the problem solving part, the but part later on more effectively. And they probably aren't going to be able to take in that information. So reminding myself, like, I'm not giving up on the but, it's just coming later, and it's coming in a way that then is a bit more accessible for them to really hear.
I think
Uh,
one final question, Anya, for you to speak to is, In our workshop, do we address how to apply these skills to bipolar illness in teens during rages and or self-harm behaviors?
Yeah, so thank you. That's really great question. So I will say that we give a very general high level format in these classes. And so if you are a parent that is struggling with kids that have more significant behaviors or more significant self-harm, it might be a starting point, but I really encourage you to work with your individual therapists about how to apply these skills. Particularly for bipolar disorder, I can recommend like family focused therapy, FFT, for parents with bipolar disorder. It includes a lot of the same things that DBT includes in helping support teens with bipolar disorder. And our class might be a good additional class, but it is not, or if you are a parent that has suicidality or your teen is suffering from suicidality and self-harm, you might need a full DBT program or what we call like comprehensive DBT, which actually answers another question in the chat, which was, is there a DBT group for skills and parents? So in adolescent work, all of DBT includes parents. So if your kid does have suicidality or self-harm, the DBT in its full version includes a skills course where you and your teen together learn these skills in a class format, as well as, and then your teen has access to an individual therapist, where they're doing very specific work to how to apply those skills in their lives. And you have access to a skills coach 24/7 by phone to help you apply them in your life. So this is for like higher level risk issues. I recommend you reach out to our general clinic front desk and inquire about adolescent DBT. And so you can.
Oh, yeah. This was a brief overview. And so we're in advance. I'm going to quickly drop a link for the parenting skills in the chat.
Yeah.
So,
Yeah. So those are our recommendations because this is kind of like a bigger picture, but yeah, it's much more in depth. You get a lot of treatment when you're in the full comprehensive DBT program, and it's for teens and adults. I mean, teens and their parents together. Okay. Well, we are we're at about time. And just there's one really great question about like how do we navigate validation when it begins to sound dismissive? I'm going to answer this really quickly because I think it's such a great question. I don't want to leave it, but I will say like attend our course if you can. I think the biggest thing is like varying, like sometimes validation sounds dismissive if you don't really mean it. So I think really checking in to make sure you have really done the work of like you truly are trying to understand where your kid is coming from. And sometimes switching it up a little bit or really focusing on like the other types of validation, like really just paying attention and really just being like, okay, it seems like I'm being open to correction. Like it seems like I'm really not getting where you're coming from. Like I really want to understand what you're saying and like letting them kind of provide feedback to you is one way to maybe make some repairs if you feel like it is coming off as dismissive. All right, I hope this introduction was helpful. I hope everyone has a lovely day, and maybe we'll see some of you in our course
yes. Thank you. Happy Wednesday.
Wednesday.